Provider helps employees with housing to boost recruiting efforts. U.S. News will tweak its nursing home rating system to focus more on quality of care and staffing. Opioid legislation goes to President after Senate passage. And a study claims nursing homes increasingly pushing residents to unnecessary rehab at end of life. This and more next.
You're watching LTC News with Dane Henning.
Welcome to CNA TV Long-Term Care News. I'm Dane Henning. Today is Wednesday, October 10th, 2018. Not every nursing home wants to become an employee's landlord, but a Canadian facility is branching out in an effort to boost recruitment. Glen Haven Manor in New Glasgow, Nova Scotia is opting to offer affordable housing to its employees within walking distance from the 200-bed facility. It's renting out a nearby house and then subletting rooms to employees in need, the New Glasgow News reports. Glen Haven Manor is offering its units to staff someone who have been relocated internationally or outside of the region, or resident family members in need of short-term accommodations to visit their loved ones. A switch is coming soon to how U.S. News and World Report publishes its much-viewed nursing home ratings. The media company announced last Wednesday that it will put much greater emphasis on staffing levels and quality, a move that coincides with the Centers for Medicare and Medicaid Services' recent change from self-reported staffing data to payroll-based staffing data. U.S. News said that during the 2018 to 19 span, it will no longer use CMS's overall star ratings as the basis for calculating its own overall ratings, as it had in the past. Although, like CMS's ratings, staffing, inspections, and quality will contribute to the numbers. Three factors encourage the change to their rating system: the frozen health inspection data going back to November 2017, the change to a payroll-based system for staffing assessment, and expert view that CMS star ratings overemphasize less reliable data and underemphasize key data points. We'll be back right after this break. Long-term care advocates are applauding sweeping legislation passed by the Senate and Congress last week that aims to address the nation's deadly opioid epidemic. Nearly 125,000 older Americans were hospitalized in 2015 for opioid-related diagnoses. The bipartisan legislation creates, expands, and authorizes programs within almost every federal agency and aims to address prevention, treatment, and recovery related to the drugs, the Washington Post reported. President Trump is expected to sign the legislation. Meanwhile, the Medicare Payment Advisory Commission is meeting to take a closer look at the issue of opioid use among the senior population. It's scheduled 2 sessions, with one discussing Medicare Part D drug beneficiaries who have experienced bad opioid reactions, and another exploring whether the hospital payment system encourages the prescribing of opioids, Bloomberg reports. A new study contends that nursing homes may be pushing dying patients into unnecessary and potentially harmful high-intensity rehab services. University of Rochester Medical Center researchers noted that the number of residents receiving, quote, ultra-high rehab services in New York State increased by 65% during the 3-year period ending in 2015. Most of those services were delivered to individuals in the last 7 days of their lives, according to the analysis of data from 647 nursing homes in the Empire State that was published this week in the Journal of American Medical Directors Association. Researchers honed in on residents in the very high 520 minutes per week to ultra high 720 minutes groupings of rehab services in the last 30 days of life. Authors speculated that rehab levels for the dying may actually be higher in the states with less regulatory oversight. They also acknowledged that some rehab is needed at the end of life, though more commonly of the low or intermediate variety. This has been your long-term care news update. Everyone have a wonderful week, and I'll see you on Wednesday.